So, generally sessions kind of have a flow. Um, if it's a new client, you do an intake procedure and that's your whole session, and then you figure out what to do with them. But if it's somebody that you're working with, it generally looks like um, kind of checking in and seeing what kind of practice, whether the practice, well, I should go backwards since you're asking. So generally all we do is offer practices. Which is kind of a funny thing to say, but it's not totally obvious. Your entire job is to figure out what practices might help the person for whatever condition they have. So that's it. There's literally no more to it. It's our scope of practice. It's big enough. It's plenty big enough. So that's our job. And generally, sessions look like teaching those practices. And then when people come back, kind of assessing, talking to them and seeing, how the practices have affected them and how they feel they're, doing them, if they remembered what you told them or something was hard, all those kinds of things. And then based on the feedback you get, adjusting those practices. So the actual, sessions generally run an hour-ish. Sometimes they're shorter follow-ups for me, but I've been around a while, and most yoga therapists are more on the lengthier side than I am. I like to move quickly. But, kind of standard division of time in a session would be, 15 minutes of figuring out what's been happening the last week, 2 weeks, month, 2 months, however long since you've seen them. Half an hour of sort of adjusting and assigning practices from there, and then kind of another 15 minutes of like kind of summing it up and sending them off with the thing that they need. So, some sessions are a little longer, look a little different because you're teaching them longer things, things that take longer to learn. And some sessions are shorter because they basically learn them and you're tweaking them. You're more leaning towards teaching people things that they can do on their own. Like, sometimes when you're a PT, you have like, say, 3 sessions a week, or you're trying to do something in real time. As a yoga therapist, you're giving people skills. So that's really the only, as a manual therapist, you're doing manual therapies, but as yoga therapist, you're really just teaching. So you can think of it like that, like in this hour or whatever I have, how can this person walk out of this office knowing what to do for the next month, say, for themselves? And so that's how we think about it. So that's your goal. And honestly, most of the time our practices are not super long, like our sequences aren't long, or the things we're teaching them. If you're clear, you don't need super lengthy interventions. So, you kind of stay economical and teach people what they need, and that you're kind of sending them home with that. And then there's in terms of the session, there's always like time for your therapeutic relationship, which is part of any of these things that you're talking about, right? So you need to know each other, they need to trust you, they need to feel like they're being listened to, but in the end, your goal is to teach them those practices. That's what's on the top of your mind, the entire time. Otherwise, things just take forever, and it becomes, among other things, not cost effective. So, like a lot of yoga therapists kind of do this like really slow thing. But that doesn't work, unless somebody has unlimited time and money. So I try to keep that in mind as well. I generally use a lot of video and audio recording in my practice because I'm often tweaking it a little more specifically. So, I record lots of things I do with a little Zoom recorder, or usually with their phone, which, over the year, it wasn't always that way. I used to write things down more, but I've noticed that people respond way better to video. And then there are tools like Yoga Mate has one, and Sequence Wiz, where you have these sort of prepackaged sequence tools, which you could check out. So you build practices in there, and then you can use them. You can kind of tweak them a couple things, erase one, throw in another, and print it out. So those are all options. But generally, over the years, I've done a mix of like stick figures and videos. And that's worked out pretty well. For meditations, you're welcome. Yeah, it's fine to use anything, really. I mean, it's just a matter of whether you think like your voice is a good idea or a bad idea for that particular client. It's also great to have, sort of multiple versions of things. So, but I wouldn't think too cookie cutter, as you'll see as you continue learning. The more cookie cutter stuff would be like the physical sequences. Recommend is you definitely, even if you have more than one specialty, you really put some time into figuring out what you want to know. And a lot of it is, some of it is how you're going to work with people. And some of it is people's ability to feel like you understand their condition. So, like anyone could teach yoga for cancer with a one-day seminar with me. And I'm not an expert even, or the people we have come and teach it. Like, it's not that hard to work in like a breast cancer unit in terms of, the teaching part, but what you do need to know is all the ways chemo affects people and what's it like to have a port. And, you don't want to put that port on the ground, like someone's chest right on the ground when they have something sticking out of there, and what it's like, what kind of like sort of emotional stuff someone might be going to, so you can be a little more sensitive to that. And it's the same with many other things.
Okay.
And so it's like, you could definitely, like, I could walk into a cancer ward and teach a class tomorrow, and then I could turn around and, work with a football team, and they're very different things. But just because I can do that, I don't market myself to all the things, if that makes sense. Like, for me, I would say it's kind of two things. My job's different than yours because like I run a yoga therapy school, so I got to know a little about a lot, right? As part of my job. And my practice was sort of like that by accident. But in terms of working with people, it's like, we did our obesity work, and that was like a huge part of my practice. So it's like a specialty. And of course, people who are obese have all the other things that happen to people. They get cancer, they hurt their back, they have depression. So of course I worked with all those things, but that was sort of like my target. Like, I'm somebody, and the reason for that was among other reasons, one of the big reasons is that if you were obese, it's hard to find someone to work with, because you're not sure if they're going to judge you. You see some like super fit yoga teacher, right? And you're like, should I work with them? I don't know. Maybe every time I come in, they're like, there's the fat guy. I don't want that. So, that's part of it. And that's true with everything, like trauma, I mean, I do a lot of that too. And so slowly what I kind of did is like specialized in different things and built little kind of worlds around them. And some of them were like more public, like the obesity stuff. Like I wrote a book and I gave seminars, and some of them were more just being very well informed and letting people know I worked with that. So that's more like the trauma work I've done. I never like went out into the world and tried to proclaim myself a trauma expert, but I worked with hundreds of people with big traumas, so, from a work standpoint, it's really good. It's really hard to market yourself as like I can do everything yoga therapist. It sounds almost crazy, but what I would suggest is you find one or two things to kind of hang your hat on.
Okay.
Knowing that those people are going to have all the other things. It's not like people with trauma don't get plantar fasciitis. And then once they're in your orbit, that's how, or they're, a lot of times I would be working with somebody with trauma and they're like, I mean, I just got to ask you, I know that's not what we do, but you do physical stuff, right? Like they'll see some, you know what I mean? I'm like, yeah, of course. And they'll say, oh, well, my husband has plantar fasciitis. Do you think you would work with him? You know, it's been really chronic for years. I'm like, sure, send him in. I'll check him out. So like a lot of times it's like that, you know, so you have the person, the main thing you're focused on sort of referring other things to you. And this kind of subtle thing you do is like in the space you're working, you can have information on all the things yoga therapists might do if you're willing to work with them. You know, I put out these little like things sometimes about different conditions or what is a yoga therapist, blah, blah, blah. And people are like, oh, I didn't know. I have all these friends with back problems. I should send them to you, you know. You can explain the larger system, and then you can also tell people what you're most interested in working with. So those are kind of two roads you can take in any conversation. You know, so someone's like, oh, you're a yoga therapist. What does a yoga therapist do? You're like, we work with a wide variety of conditions. It's a different system, kind of like the way Chinese medicine is, kind of like the way Ayurveda is. It's like, you know, we do physical stuff and we do meditation techniques, et cetera, you know, if you have the time to sort of explain it. Or you're the person who works with trauma, right? So you put on these different like hats, mostly to help the person you're talking to, right? Like that's that's your goal, to help the person understand what it is you do. If you say too much, a lot of times people just kind of walk away like, I don't know. There's a lot of people with anxiety who are not clinically depressed, but
Sure.
there are not so many depressed people who, I mean, everybody's anxious, right? So that just kind of comes with the human territory, and then it gets worse, and that's all because of Vata imbalance. So, you know, what you're looking for is when you're doing it doshically, you're looking for the predominant imbalance. So, look, everybody with depression has anxiety, but if, you know, getting out of bed in the morning is the issue, you know, or, you know, lots and lots of negative thoughts that are not sort of like anxiety based. I usually go in that direction. What, you know, what you're seeing does matter, you know, because, you know, you get other clues like, you know, just general kind of vibe, energy levels from people. You know, a very Vata imbalanced person might be more scattered, but have a lot more kind of externalized energy than a really depressed person. So someone with both, you know, you can see that they're like, you know, barely lifting their head to talk to you is a very different person, right? So, you know, that's a thing too. I mean, the other thing to remember is that you have a koshic way of looking at it as well.
Yeah.
So, you know, you have that lens of like, is this an energetic issue?
Right.
Is this a kind of deeper thing, you know, kosha wise, that we're looking at? Is this person like just sort of totally disconnected? And if they are, is it like a lack of, you know, ananda awareness, or is it not enough energy to have that awareness? You know, you might make different choices. You might bounce between those two models just to get your thought process together.
Okay.
Around which practices to give them. And it gets really nuanced with mental health. It gets very, very nuanced. So I'm giving you the sort of general, you know, the big crayons. You're not actually treating depression or anxiety. That's the thing to remember. You know, we use those words because those are the words we live in, but that's, you know, people with depression have different doshic and different koshic imbalances. A lot of them have kapha imbalances, people who are depressed, but a lot of people have also suffered traumas and have lots of stuff in the Vijnana Maya kosha they have to work through, you know? So that's why we have the two models, for you to start to think that way and be like, what am I hearing? This person says they're depressed and was assaulted, and this person says they're depressed and no trauma at all, right? So these people have lived very different lives. So it's probably manifesting differently. So yes, there are many, many options. It's a creative activity being a yoga therapist. We try to give you some guidelines, but it's not really super prescriptive. Most schools do it in a prescriptive way because They don't, well, I'll say it this way, I'm half joking. They don't believe in you. You know what I mean? It's like yoga therapists are in relationships with people and they have to think on their feet
Mhm.
and bounce between things. You can't just take one evidence-based practice from a study. You can definitely try it, but like that doesn't give you the information you need to work with depressed people, for instance.